Perfect. Hi, everyone. My name is Dallas Barnes. My pronouns are she and her, and I am the founder and CEO of Reya Health. We're experiencing a massive sexual health crisis right now, especially amongst the insurer and benefit provider space here in Canada. What this means is that 50% of Gen Z have reported stopping using birth control because of side effects. This is seen across international students and felt mostly in that student population. Last year, for instance, 40% of female international students in Ontario had an unplanned pregnancy. We're seeing higher rates of these unintended pregnancies, STI treatments, and increasing sexual health related claims within the insurance space. These are rising costs for the providers, and yet schools are experiencing a lack of resources and lack of support to support their post secondary students. And so they're actually turning towards the insurance providers and their student health and benefit providers for support. Reya Health is a digital platform for personalized sexual and reproductive health. Reya reduces these high rates of sexual health related claims, reducing unplanned pregnancies, STIs, and sexual and gender based violence. We provide personalized contraceptive counseling and sexual health education and support for students and young people. How we do this is in four key pillars. So we take a very personalized approach to contraceptive counseling, utilizing a questionnaire that was created by a team of medical professionals, OBGYNs, family physicians, and naturopaths contributed to the methodology behind our birth control matching questionnaire and the rest of the medical aspects of the platform. We support students through education and ongoing support. So, in education, we provide a comprehensive understanding of all birth control options available in Canada. We provide a detailed and personalized next steps plan for users on the platform and how they can look at their sexual health journey moving forward. We do provide a side effect and symptom tracker, similarly to a period tracking app, but specifically to how a contraceptive might make somebody feel, providing personalized insights and key resources there as well, so they feel that continued support all along the way. Of course, safety, privacy, and accessibility is of utmost importance to us as a platform. So we do have additional ways that folks can learn about different language on the platform. We are compliant with the privacy and health laws here in Canada and then looking also at the international health laws as well. We do meet those regulations. And doctors are loving us. Actually, Dr. Rahima Alani heard about our platform and she said that that she's thrilled. Reya will be a go-to resource for people when figuring out which birth control options would be the best fit for them. And she believed in our mission so much, she has since joined our board and our medical team. Dr. Thara Vayeli says that Reya's solution is a much needed revolution in the patient experience. So, how it works. So, Reya actually is distributed through the health plan providers themselves. These providers then distribute Reya Health to those individual school plans. So, across their either their EAP or that student health and dental plan that they have across various schools. Then, of course, the students have access to the Reya Health platform through their student health and dental plan. In turn, students receive sexual health support. They receive this education and are experiencing less unintended pregnancies, and therefore less sexual health related claims are actually being made. The schools, of course, are happy. This is preventing the sexual health crisis that we're seeing, but also it improves academic success across the board. And of course, that lower sexual health related claims cost for providers, as well as drug adherence. So we know that when folks are using options that they feel comfortable using and confident in, that drug adherence is increased or that method adherence is increased. And that's something that providers and insurers do care about. Traction to date. So we've launched a version in the past, an MVP. We've worked with hundreds of beta users and achieved a 95% user satisfaction rate. With this new platform towards the insurers and the providers, we do have a mobile app that's ready to launch in this format. We have a partnership already secured with Student VIP. We're going to be running 4 pilots with them, as well as being a part of their preferred provider network. We have a partnership with Planned Parenthood in Toronto, and a preferred provider partnership with a couple of other colleges and universities here in Ontario. As per our go-to-market strategy, you can see on the far left side, which this should have been broken up, but bear with me with the downloads. As I mentioned, our go-to-market is first launching with pilots. So one pilot is one school benefit. So with Student VIP, they really wanted to pilot Reya Health in some of their schools where they're seeing the highest rates of sexual health related claims. So with these pilots, the students on those specific plans get full access to Reya Health. We provide an implementation and marketing plan and dedicated check-ins with the plan managers to report on KPIs. And these pilots also include an MOU and an LOI to continue conversations for our further blown out pricing model. We have 5 of these pilots committed. Our goal is to acquire 10, and we're in discussion with various other student health and dental plan providers and other insurers across Canada. The pilots, we will receive more validation and traction and creating more of a business case study that we can use for scaling in the future. Speaking of scaling, our business model as we're looking at it now is $1.50 per student per month. So this is a quite typical business model that these student health and dental plans operate on. And going by an average student population in the Canadian post-secondary institutions throughout Canada, we have a goal of about $1.2 million in revenue for 2025. And actually, our top sales lead currently services 1.5 million students here in Canada. So that really opens us up to a really large revenue opportunity. In terms of our roadmap, this year, 2024 and Q4, we have a lot of really exciting things happening. Our pilot program's launching, our new product is launching, and officially launching this new channel in Canada. In 2025, we are focused on that revenue repeatability and that expansion of their business models, so going to that per student per month, as well as expanding into EAPs, so employee benefit plans. Expanding out our product offering as well. And then later in 2025, we have channels already set up to expand into the US through our partners at Planned Parenthood and other insurers that have that international reach. We do have goals of $1 million in 2025, as I mentioned, and then 2026 and beyond. Really, it's all about that growth on the market expansion. This is a global problem, as well as feature expansion and product expansion to reach those revenue goals that we have. In terms of our market, our obtainable market in Canada is about $27 million in annual recurring revenue. Overall, there are 1 million students who access a student health benefit plan globally. So as we continue to expand, this continues to be a very opportunistic business model and plan for us. In terms of competition, there are a few other startups that are approaching this problem. Aiden and Tune take a more pharmacogenomic approach. So they utilize at-home DNA testing kits. This requires extensive R&D, and the research currently is quite limited and not enough yet to base a evidence-based decision off of for contraceptive counseling. Aiden launched their MVP at a $400 USD price point, direct to consumer. We're really excited to be able to have the impact with our solution that's ready for market now, but also in a way that's affordable and accessible for the end user. Of course, there's traditional health clinics, but this perpetuates that one-size-fits-all approach that is causing a lot of the problems we're seeing in that lower adherence to contraceptives currently. In telehealth, we see this as actually being a really great collaborator and partnership opportunity for us to integrate and embed and really personalize that experience digitally. As per our team, I am a sexual health and reproductive rights advocate. I launched the HPV advocacy campaign, working to extend OHIP coverage for all vaccines, or sorry, HPV vaccines. All vaccines would be cool. I actually have a personal relationship to this problem. I spent years trying to find different birth control options. One method I was using, my body reacted so adversely that I was admitted to the hospital. I was also a student at this time, and it really impacted my academic success, and actually resulting in me claiming different mental health supports as they were available to me, and also sexual health related claims. On our team, we have Lindsay Chastain, a person of note. She's our very hands-on marketing and growth advisor. She worked at Ancestry as the director of partnerships and Sephora as the director of digital marketing. Dr. Rahima Alani works at Planned Parenthood as a professor at the University of Toronto and does workshops and professional education with various pharmaceutical companies. So join us. Reya will be the global epicenter for sexual, reproductive, and hormonal health data, information, and support. Thank you all so much. I appreciate your time.
Wow, Dallas, 12 minutes on the dot.
Wow.
I was like, okay. I'm like, Jane's gonna cut me off soon. I know it.
Okay, that was great. Thank you.
I'm going to come back and stop sharing my screen. There we go.
Okay. All right. Well, Leah, you've already taken yourself off mute, so how do we start with you?
Oh, sorry about that. Sure. Yeah, like I was scribbling down notes and questions as we go. But first of all, thanks for choosing such an important issue. This is amazing and great for women everywhere, especially young women. Love it. One of my questions, I just want to back up almost to the beginning with a question on. It sort of sparked my interest when you're going through the stats on the second slide or whatever about how women are, stopping birth control and all that. What's the change in society today that's causing, I guess, different behavior? Like, how is this different than 20 years ago? Is there a trend that somehow shows that women are, stopping use of birth control? What's causing this?
Yeah, really great question. And I have so many different ways to take this. Do I have time, Jane, to add some 2 cents here?
Yeah, well, for sure. We've got until the top of the hour for all of the feedback.
Okay.
So
first and foremost, there's more options than there were 20 years ago. And so that decision has just become larger. But also the way that we are further understanding women's health opens up opportunities for folks to ask questions and really have more autonomy over how they want to be feeling on a contraceptive. 20 years ago, it was when, that, how do I describe this? Almost lesser of two evils. So people were more tolerant to the symptoms because they didn't have as many options, or the education around pregnancy prevention is one thing, but also the overall contraceptive counseling has traditionally been seen as that one-size-fits-all approach. So typically there are the go-to options that any physician might have, and this process with Reya Health really helps educate the individual and almost takes a more informed consent approach so that they are aware of what's happening and the changes that are happening with their bodies. Non-hormonal options are becoming more popular as well. And so focusing more on that autonomy just by way of which society is going and leaning towards in health generally.
I would love to see a slight flavor of that right up front in the presentation, because to me, it kind of jumped right into the impact of the problem. Like, hey, people are dropping off this. but it's almost like, how do you tell a bit of a story about, yeah, if I could synthesize back what I just heard, a few things, about the people are more informed, there's more technology available, science has come a long way, and it's causing, these issues to occur. I also loved your personal story, which you brought in near the end. I might have that right up front. I might say, I'm passionate about this. Well, you guys are laughing.
Yeah, Leah, sorry. We're all I did
I'm late
have
to the party.
honestly, up until last week, I've always led with my story, and I've sort of moved away from that because the feedback that I was getting, and I would actually love to reflect this back to you, was starting with my story made it all people were already thinking, okay, this is an individual problem. It's direct to consumer.
No, that's why I would add, yeah. So no, I would add in the other bits. I would say, I think there's something just missing at the beginning about what the state of the union is. Like what has happened in the past 20 years to make this now an issue? When I was younger, I mean, again, like you said, we didn't have a lot of choices and it was the way we went. So, and maybe you could say, I even have a personal connection to this, this has even affected me personally. Maybe you don't start with that being the only thing, but bring in some of the what's happening, and then you can go into and that's resulted in these other problems. I did find that there's a lot of information in your slides. I'm sure you're trimming it down, and I found it hard to get through everything. But that first problem was on my mind, and I also wondered if there was a way to represent if there's any information on trending. I always find data points are kind of more interesting if you can see a change over time. And I don't know if that's even possible, but if over 20 years ago, if 20 years ago it was this, but now, people are stopping birth control and, at the same time, I don't know what that is, but I'm a very visual person and I like to see information change over time to say that this is the why now, right? This is how do we get into the why is this an issue right now? Because I miss that context. I appreciate you're doing these pilots. I was trying to understand the go-to-market model and the piloting, and then you jump to the how much it'll ultimately be per student. And so then of course my questions are, wow, how did you get to that ARR? So again, I'm kind of where's my chart to show the growth of ARR? I'm visual, quick, simple, like here's how we're in pilot phase and here's where my ARR is going to. Sorry, I'm kind of rushing through some of this feedback. But yeah, the money, I mean, as an investor, clearly one of the most important things I want to see is this business model realistic? It sounds like you know the industry well, so you know how it works through the providers and down to the schools and down to the students. Are students willing to pay for something like this? And is that ARR realistic? So just kind of seeing how that builds, that's just really critical for me. There were a couple little bits of feedback I would give on some of the presentation, like that roadmap slide, super detailed, hard to get to what the key point is. In fact, you had like 4 lines and you started on the 3rd line. So I had to follow where you started talking about the product. So I had to go down to that 3rd line to figure out where you were talking. And then, it was sort of like maybe build your slide or, focus on what you're going to say first, this kind of upper left or left to right or something, so I can quickly get with you to follow your points in the slide, even if you had to build it out. We're here, we're going here, we're going here, because I was jumping around. It was a similar point of feedback when you got to your team. You covered you, and then you jumped to the person on the bottom right, and I spent time trying to find out who you were talking about. So if you have 3 people you're going to highlight, put them on the top 3 or the 1, 2, 3, and then put the other people underneath. It's just kind of an order of like, I am trying to keep up with you and follow the information on the slide, but if I have to jump around, it takes me away from what you're saying. Yeah, those are my just some quick bits of feedback.
Great,
Thank
thanks,
you.
Liz.
That's very helpful. I appreciate that.
Okay, when I said top of the hour, I meant bottom
One
of the
last question, sorry. What does Reya or Raya stand for?
Reya,
Reya.
honestly, I just made it up.
It might be good to have an answer.
Yeah,
As a
I'm
marketing
need to
person,
come up with a story.
yeah, I'm always looking for the meaning. I saw your logo right away. I got the logo. I understood that, but I was like, wonder what that means.
Yeah, I did
Okay.
a big
Think on
brainstorming
that.
session
Think on
for-
that, Dallas, because I want to make sure we've got enough time for Melanie.
Thanks.
Okay, Melanie, go for it.
Hi. Things I'm definitely more clear on things now than from when we first met, like back in the spring.
Yeah, lots has
Back then I
changed.
was thinking it was a consumer health app. And so I think being really clear up front that this is not necessarily a consumer health app where people are going to need to go looking for it, download it from the App Store and decide to use it. The fact that it is kind of being distributed to a very specific population through their university health plans makes it a very different thing entirely than it was in my mind initially, and makes it a bit more of a viable business. Because I know, like as a physician, I know there's people download these apps all the time. They use them for a few weeks to a month and then they abandon them, right? And they'll sign up for a free membership and then that's gone. So as an investor, I'm suspicious of consumer health apps. So if this is something very different, then kind of hit on it. I was curious about the men, because this seems to be like, if I'm on contraception and it's fine and I don't have any problems, am I ever going to open the app? Because the front of it talks about contraception, but if there's also all this sexual health education on there, like if the purpose is much broader, and then are we looking at the sexual health of men? Are the men expected to pay the $1.50 a month? Is that part of the health plan? Bucket of things that they're paying for, can they opt out? You don't have to answer. It's just those are questions that investors might have in there. The issue of why people are not using contraceptions anymore. There's three major inventions in medicine that have kind of changed the course of the world, right? First, antibiotics, vaccines, and contraception for women. Those three things are three of kind of the biggest medical discoveries that have had the largest impacts on kind of the long-term health and well-being of society. But then we see that vaccines are under threat, right? From a growingly kind of mistrustful, sometimes conservative right-wing beliefs really attack vaccines. And it's part of that overall mistrust for authority, mistrust for doctors, mistrust for pharma, all of that got really bad during the pandemic. So that's part of this issue of contraception. And even within your presentation, it's sort of being presented as like contraception's a necessary evil that like we need to have because it's good to be able to prevent pregnancy, but it causes all these problems and it's ruining lives. But like contraception's a miracle, right? Like it's amazing that we have this. And it's such a privilege, especially when you have the privilege to actually be able to use it, right? And to not have a government or politicians tell you that, oh, maybe you shouldn't have access to contraception. So it might be nice to have a little bit of that flavor in your presentation, that it's not a bad thing. It's amazing, but we need to make sure that people are getting access to the right one for them to prevent health effects. And then it's like wonderful that we get to have this type of thing. When you were talking about health providers, sometimes health plan providers versus sometimes we just call like doctors and nurse practitioners and like healthcare providers. So that was just something that I had down as kind of
that's a really great point.
So clear there. But I think like overall, I would say from an investor point of view, trying to get as close to the top of your presentation as possible, what your solution really is, and kind of what it isn't. And what it isn't is it's not a consumer health app, which people after like the digital health bubble kind of burst, investors are a bit suspicious of digital health and health apps. So you need to make it like clear that this is not quite that.
Great. Thank you, Melanie. Okay.